Infertility affects women around the world and the prevalence of the problem is increasing. Today, we will be discussing about the causes of infertility in women and what can be done to reduce the risks. Joining us is Dr. Sulbha Arora, Clinical Director, Nova IVF Fertility, Mumbai. She has been practicing as an IVF specialist for the last 17 years. Welcome, Doctor.
Thank you so much for the introduction and thank you so much for having me here today.
So, Doctor, what are the causes and risk factors of infertility in women?
So, infertility is a rising problem, and there are a number of causes that are rising because of which the overall incidence is rising. First of all, it isn't only a female problem, though, yes, we're discussing female infertility today, but let's say it's about 50% of cases we find the problem with the woman, and in 50% of cases, it's with the man. And as far as the incidence of infertility is concerned, it's considered that out of every 6 couples of reproductive age who are trying to get pregnant, 1 out of every 6 will face difficulty conceiving. So now, what are the reasons in the woman? What are the factors in the woman that can cause a problem? Some of the commonest factors, for example, are hormonal issues, like, for example, PCOS or PCOD, which is a term that most people have heard of. This is the commonest hormonal imbalance in women of the reproductive age group. When women have PCOS, they don't necessarily ovulate every month. So if the egg which should be produced in the ovaries and released is not released, then how will a pregnancy take place? Because for the pregnancy to take place, the egg and the sperm have to join. Now, there are other hormonal imbalances as well, which can cause anovulation. That means the egg not getting released from the ovary. These hormonal imbalances include things like thyroid or prolactin. Even women who are at the extremes of the weight range, who are really underweight or really overweight, they also have hormonal imbalances which can contribute to the infertility. Now, other factors which can cause infertility in women, you basically need a healthy uterus, you need patent functioning fallopian tube, and you need good quality eggs. So in any of these 3, if there is a natural barrier or a problem, then that can cause a problem conceiving. For example, with the uterus, there can be certain problems, certain growths like polyps or fibroids. These are quite common. They are benign growths, so you need not worry if they are there. But yes, they can cause an obstruction and may need to be removed in order for you to conceive. There are certain problems in the uterus which may be there from birth. For example, a septum, which is like a wall inside the uterine cavity, which causes an obstruction in the space. That may need to be removed if it's there. Similarly, certain problems that can occur not from birth, but later on in life are adhesions inside the uterine cavity, where the uterus gets stuck from inside, mostly after a surgery such as a DNC. This is as far as the uterus is concerned. Then you have the fallopian tubes. Fallopian tubes are very delicate structures, and for them to be open and functioning normally is very important for a woman to be able to conceive, because that is the pathway for the egg to come inside the uterus. If the tubes are blocked, if they are stuck, there may be conditions like endometriosis, which can cause them to get stuck or damaged. There may be certain pelvic infections, tuberculosis. These are all things that affect the fallopian tubes and can damage or block them. Then coming to the ovaries, like I said, one of the reasons is anovulation, where the eggs are there, but they don't necessarily ovulate. But what is becoming an even bigger concern now is the aging of the ovaries. As our age increases, our ovarian reserve decreases. So if we have reached a point in time where the number and the quantity and the quality of the eggs has started declining, that again can cause problems conceiving, because nowadays people are getting married at later ages than they were before. So aging is one of the most common factors, and in fact, the woman's age is the single most important determinant of a couple's fertility. So these are few of the common reasons why a woman may not conceive, why she may face difficulties when she's trying to conceive.
So, Doctor, diet and lifestyle has anything to do with infertility in women?
Yes, it does, because as I was saying, that as a woman ages, her chances of conceiving reduce. I'll just explain a little bit about this. There is something called a biological clock that we have heard of, right? And that it ticks as we grow older. So when we're talking about the biological clock, we're talking about the ovarian reserve. Now, women are born with a fixed number of eggs, and we cannot make new eggs in our entire lifetime. It's like being born with a fully charged battery that starts draining right from birth.
Okay.
And we are not born with a charger, so we can't charge it back. To give you an idea, at birth, a woman has around 20 lakh eggs in her ovaries. By the time she gets her first period, this is already reduced to 4 lakhs because the number of eggs starts reducing right from birth. And there comes a time where the number of eggs has become considerably less, the battery is weak, and then the battery dies, which means there are no more eggs left, which usually happens somewhere in the 40s. But since the speed of aging is different for everybody's bodies, some women may reach, even in their 20s or 30s, a point where the ovarian reserve is considerably diminished. Now, aging is something that cannot be prevented. But like you asked, what about the impact of lifestyle? Lifestyle changes are something that are under our control. So there are lifestyle changes that we can make to boost our fertility, to improve our chances of conceiving. Now, for example, a lot of people may not know, but even something as small as not sleeping well, not getting adequate sleep can reduce your fertility levels. So if you are unfit, if, like I mentioned, you're in the extremes of the weight range with the less than normal or high than normal BMI, again, your chances of conceiving would be lower. If you are not getting enough of exercise, if you have a very sedentary lifestyle, plus if you have addictions like smoking, smoking can cause a very much faster depletion of your ovarian reserve. It can also impact your egg quality. People do know that smoking causes cancer, but not many people know that it causes premature menopause. So these are some lifestyle factors that are within our control. They do cause, reduced fertility rates, and making positive lifestyle changes in these aspects can definitely improve our chances of conceiving.
Okay. So, doctor, are there any signs and symptoms that can indicate the risk of infertility in women before even planning to conceive?
Yeah, okay. So, first of all, when do we say that somebody is infertile? Like, when would I know that I may be having infertility? When a couple has been having planned relations, or just having relations for a year without using any protection, but after a year of having regular intercourse they haven't conceived, that is when we say that they could be facing a fertility issue, because most couples would conceive within 1 year. When the wife's age is over 35, we don't recommend that they wait for a year before consulting a doctor, because age has an impact. So they need to meet the doctor sooner, within 6 months of trying. Now, other than this, other than the fact that you've tried for a certain duration and not conceived, there may be certain other indications you can get that you may be facing a fertility problem. Now, not infertility itself doesn't have any signs apart from not conceiving, but there are underlying causes. Now, for example, if you have irregular periods, painful periods, heavy periods, weight gain, and other hormonal problems such as thyroid can also cause lethargy, intolerance to colds, weight gain. A prolactin hormonal imbalance can cause a milky discharge from the nipples. So these are all problems that can point towards an underlying infertility problem as well, and you must get it checked out.
So, and doctor, what are the things that we can do, like women can do, to reduce the risk of infertility?
Yes, so like I said, aging cannot be stopped. And there may be a time, when you are reaching 30 or just crossed 30, you don't yet plan to have a child, you don't even yet plan to get married. One thing that you can do is get your ovarian reserve checked, because we are seeing more and more cases of low ovarian reserve at much younger ages than what it should have been. So if you're, very simple ways to check your ovarian reserve. There is a blood test called the serum AMH. There is an ultrasound for the antral follicle count. If you have done this test and you are satisfied, you've been told that your ovarian reserve is good, that means you need not panic, you have enough time. But if you have been told that your ovarian reserve is declining or has already rapidly declined, then you must consider egg freezing if you're not yet planning a baby. So that is one thing. The second thing, like I've mentioned a couple of times already, lifestyle changes are very, very important. You want to plan a pregnancy in future, this is the time to start making the lifestyle changes. It is said that at least 3 months prior to conceiving is when your lifestyle modification should start, your positive changes should start. But some women need a longer time to get their bodies ready for conceiving.
Mhm.
If your BMI should be between 20 and 25. If it is over 25, then you need to get an exercise regime in place. See, exercise
Mhm.
has a lot of benefits for your mind and for your body. So even
Mhm.
if you exercise, moderate exercise, about 5 days a week, half an hour to 45 minutes, even if you just go for a brisk walk, that is going to go a long way in helping your mind and your body. Eat well, eat good, nutritious food. A basic rule to follow is anything that is natural is better than anything that is packaged or processed. And that is another thing to keep in mind. If you're overweight, you may also have to consult a nutritionist or
Mhm.
on your own try and cut down your unnecessary calories, your refined sugar. Stay hydrated, drink a lot of water. These are all things that contribute to your general health and therefore also contribute to your chances of conceiving.
Mhm. And when do you suggest IVF treatment for infertility, like wants to conceive?
There are some cases where the couple comes to us and we know right away that an IVF is the only option. For
Mhm.
example, if the fallopian tubes are damaged or blocked,
Mhm.
or if there is a condition called endometriosis, which causes dense adhesions, that means the tubes, ovaries, everything gets stuck to each other. Because
Mhm.
in these cases, the natural functioning of the body will not occur, where the egg is released from the ovary, picked up by the fallopian tube, and brought into the uterus. When we do an IVF, we bypass the fallopian tubes. We don't need them to function because the fallopian tube is what the path for the egg and sperm to join inside the body. When we do the IVF, we take the eggs out and fertilize it with the sperms. So, number one, if the fallopian tubes are blocked or damaged. Number two, if there is endometriosis, where the pelvic environment is unhealthy.
Mhm.
Number three, if there is a problem with the male, like the sperm count or motility are really, really low. For you to conceive naturally or by simple treatment methods like IUI, you do
Mhm.
need a very large number of sperms. But IVF can be done with very few sperms as well. These are some of the cases where you right away may need an IVF. Then there are other cases, for example, you've tried the simpler treatment methods like IUI repeatedly, but it hasn't worked. Then we tell you that now there's no point going on and on doing that, and doing an IVF will benefit you. And
Mhm.
otherwise, like I've mentioned, that when age starts to creep by, then we start to run out of time. So a woman in the older age group, a woman with lower ovarian reserve, less number of eggs, even if she's in the younger age group. For these women as well, it's better to directly go in for IVF. It's not like they can't conceive naturally or by IUI, but when your ovarian reserve is low, your chances of conceiving naturally or with IUI would be considerably less. And then we know that there is a little bit of time left before your ovarian reserve declines further. We don't want to spend this time trying treatment options that have very low chances of success. And we know that out of all the available choices, an IVF does have the best chance of success. So if we know that the ovarian reserve is low, it's best to directly go for the IVF and get pregnant before your ovarian reserve has declined further.
Mm. Okay. So is there also a case where the fertility chances is almost zero? Like couples can't conceive at all.
Well, it depends. There are certain cases like that, but then there are treatment options as well.
Mm.
Now, for example, a woman who is almost reached menopause or premature ovarian failure, where her ovaries are no longer producing eggs, she
Mm.
wouldn't naturally be able to conceive. But even in such cases, donor egg IVF is always an option. And
Mhm.
this is a situation we do see commonly with more and more women getting married at later ages, and especially if they've tried with their own eggs and it didn't work. They are the kind of women where a donor egg IVF is very successful, because luckily, as age advances, the uterus remains a strong organ. The capacity to carry the baby remains good. It's just that the eggs which need to be donated. Now, similarly, where we would say a woman cannot conceive, also, if you see the uterus, if the uterus is badly damaged, if it is badly scarred because of a previous surgery, if it had to be removed, for example, due to cancer or due to very large fibroids, or there are certain genetic conditions in which a woman is born without a uterus. In
Mhm.
all these cases, how will she carry the baby? But then these are the cases where surrogacy comes into the picture, because surrogacy is permitted for women who
Mhm.
are genuinely physically incapable of carrying the child. So though they themselves could not be able to carry, but with the help of surrogacy, they still can have a baby.
So, doctor, before we end this conversation, could you suggest any diet, special diet for those who are trying to conceive to boost their fertility?
Different kinds of diets work for different people. The
Mhm.
basic rule of thumb, like I said, is packaged food is best avoided. It has a lot of preservatives. We are anyway consuming a lot of chemicals in our environment, in our air, in our water, and in our food. Even when you eat natural, there is a lot of pesticide laden fruits and
Mhm.
vegetables, but at least it's not full of the preservatives we put in our packaged food. If you are trying to lose weight, it would be best to consult a nutritionist because different body types respond to different kinds of diets. But mostly, if you keep your calorie consumption within a certain limit, like for example, for your body weight, if your current body weight, your maintenance calories are around 1500, which means consuming 1500 calories per day will keep you at the weight you currently are, and you want to lose it, then you need to start consuming a little less, maybe 1200 calories per day. But don't go on drastic diets and definitely don't starve
Mhm.
yourself. Cutting out the fried foods, cutting out refined sugars is good for your health and for your weight. And for some women, especially women with PCOS, it helps to reduce the carbohydrate intake as well because they have insulin resistance. But any of these diets should ideally be done under the supervision of a trained nutritionist.
That's a very helpful tips, doctor. So thank you, doctor, for joining us and sharing your valuable insight with us. Thank you, doctor,
Most
once
welcome.
again.